The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Aczon-Armstrong.
Aloha! Good evening! Magandang gabi po sa inyong lahat. I'm yours truly, Dr. Marife Aczon-Armstrong, founding president of AAPINA of Nevada and professor at Roseman University's College of Nursing. Wow, we have an exciting topic tonight, and I have my good friend and colleague, Ms. Natalie Mason, with us tonight. And I just wanted to say that this month is considered a Cervical Health Awareness Month. And the United States Congress designated January as our Cervical Health Awareness Month. And nearly 13,000 women in the United States are diagnosed with cervical cancer each year, but the disease is preventable with vaccination and appropriate screening. So tonight, I had asked my good friend and colleague, Ms. Natalie Mason, to tell us more about cervical health awareness. But before we do that, maybe Natalie could share with us about her background.
Well, thank you, Marife.
Welcome.
It's wonderful to be here. I appreciate your offer to have me come. My background is in nursing for about the last 25 years, and I am now a nurse practitioner working in a clinic here in the city. I deal with a lot of pediatric and adolescents. And, of course, the big topic on display for the adolescents is HPV. That goes well with our cervical cancer month because HPV is one of the preventable causes of cervical cancer. And we're well aware that this is a very hot topic in the world today. I have extensive background in ICU and hospital nursing, as well as some education experience, and now work in a pediatric clinic.
Yeah, so that's where I met Natalie. Actually, she was my daughter and my son's nurse practitioner. So I'm really excited, and I thought about you when I looked at this. I go like, oh, Natalie, yeah. So thank you so much for agreeing to be our guest tonight. Let me continue looking at this information that I got from the website. So it says here that during January, the NCCC and its many local chapters. The NCCC is the National Cervical Cancer Coalition, and it's a program of the American Sexual Health Association. And they said that HPV disease and the importance of early detection is what they are focusing on. And that January is a month with a special focus as chapters. Their chapters celebrate Cervical Health Awareness Month, and they are working with American Sexual Health Association. And I wanted to go over. I know I shared with you this one about the different immunizations. Maybe you can share with the public when they should get the shots, and what age, and of course it would be the women who would need these shots. Okay, we're talking about cervical.
Well, we talk about cervical cancer, but we also have to realize that the HPV immunizations are for both boys and girls. The reason that being is that boys can harbor the HPV and pass it on. It's estimated that the majority of women who are getting cervical cancer in 2019, which is about, like you said, about 13,000 cases, about 30% of them will die from cervical cancer. Not because it is not treatable, but because we're not getting checked. And we're not always aware of the reasons and the abilities of the healthcare professionals to take care of things. Now, with the invention of the pap smear, our death rate from cervical cancer has been decreasing steadily in the last 15 years. But our Nevada screening on women who are sexually active is only about 79%, where the nationwide is 84%. So we are showing some lack of cancer screenings here in the city and the state. The women aged 35 to 44 are the ones that are normally most susceptible to showing signs and being diagnosed with cervical cancer. HPV is the human papillomavirus. This will account for up to 3/4 of the possible HPV causes. Now, the HPV we have out right now is only a 9 strain because there have only been 9 strains of HPV diagnosed and identified in the last 12 years. The best way that we can help prevent cervical cancer is by immunization, is by pap smear and HPV screening yearly for women who need or fall into the category of needing to have it done. And knowing that HPV cancers, cervical cancers in general, are very slow growing and can take 10 to 15 years to actually become full cancer where it is able to be staged and then treated. So what's the best thing to do if you are a woman here in Nevada is to see your GYN yearly. The task force, the U.S. task force in March of 2012 has changed the pap smear HPV screening times. Now, we weren't real happy with this at first, and I believe that a lot of the gynecologists in the area are still quite unhappy with this. But they're saying that women between the ages of 21 and 65 should only have a pap smear about every 3 years if they've had previous ones that were negative. And if preferred, you can go up to 5 years, up to the age of 65, and then they're not even testing you anymore. Where a lot of cervical cancers, I know in my research in the past, have shown between 65 and 68 years of age, they can still be positive. So whatever the woman is deciding or needs to do needs to be between her and her doctor. And come up with something that's comfortable in a screening capability. Special considerations, of course, are given to women who are more active, who have abnormal tests to start with. We want to make sure that they're tested more regularly and followed.
So I have a question. So if an individual, like a female patient, was told that they have a positive pap smear, so what happens next if they have a positive pap smear?
Well, their positive pap smears are staged, and it's according to what's called a signal. And usually you do a repap to make sure that there wasn't just a mistake. And then there's other things that you do, like when you do a pap smear, they almost always do an HPV test. And if your HPV test comes back positive, then oftentimes the gynecologist or the nurse practitioner in the gynecologist's office will do special testing in order to identify and sometimes even do what's called a colposcopy, where the cervical area is identified and washed, and then they can be removed. A lot of times when we are exposed to HPV, our bodies will fight it by itself. And we are hoping that the majority of women, their immune system is strong enough that they fight that off. However, with repeated exposure and lack of proper identification, it can sometimes cause the fact to have very invasive procedures as well as developing that cancer That, of course, none of us want to get. But a positive PAP doesn't always mean HPV, but it is always investigated further.
You mentioned earlier that here in Nevada, there's only about approximately 70% of, I guess, screening.
Right.
And then it's higher in other states. I'm just thinking, I guess, because I just moved from Hawaii, and Hawaii is one of the states who has a well baby and well visit benefits that the state is requiring all of the insurance companies to provide for their members. So I know in Hawaii we have the routine pap smear, and it is free, basically. So maybe what are some of those who are not able to afford pap smears, if they wanted to get one and they don't have insurance, is there any resources that they could go to?
Sure. Well, there's Planned Parenthood, and they take care of women of all ages. I am really not knowing that there's that many places that don't take care of well women. I mean, we have mammograms on wheels that go around and take care of all women during the times that we need to have those. There's not very many doctors or clinics that are going to say no. I'm sure the Southern Nevada Health Department would have, they have clinics and they have testing. I'm sure they could be a resource, as well as some of the clinics through UMC and even private clinics. The physicians are pretty well, I think, open to working with most women. But the well woman benefit of the insurance, I encourage women to look into their well woman coverage, because it does cover that visit as well as any testing that's done. So it may not cost them anything, but they may not know they have it available.
Mm-hmm. So this is the reason why we have this radio program
right.
to increase the awareness of our community that there are clinics available if you need to get checked.
Absolutely.
Yes. So in my notes here too, in honor of the National Cervical Health Awareness Month, AAPINA of Nevada also encourages women to start getting regular cervical cancer screenings at age 21. Mm-hmm. And parents, you make sure your preteens gets the HPV vaccine at age 11 or 12.
Right.
Yeah, so teens and young adults also need to get the HPV vaccine if they didn't get it as preteens. And you mentioned earlier, women up to age 26 and also men up to age 21 can still get the vaccine.
Correct.
Yeah, so we wanted to reinforce that information and be aligned with the goal of the NCCC, which is the National Cervical Cancer Coalition, and to the focus of early detection. So we're going to take a short break. Sorry to put you on the spot there. We'll be right back with Cervical Health Awareness Month with Miss Natalie Mason.
Hi, this is Jad Modella, and listen to a Filipino radio experience here in Las Vegas. Listen to PHLV Radio.
Your Filipino radio experience is finally here in Las Vegas. The music that defines you.
Di matitinag ng ulan, di matitinag ng bagyo.
Listen to a Filipino radio experience here in Las Vegas. Get the PHLV Radio app from the App Store and Google Play.
PHLV Radio.
This is Healthy Mondays with AAPINA of Nevada. Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle.
Welcome back to Healthy Mondays with AAPINA of Nevada. We are talking about Cervical Health Awareness Month, and I have my good friend and colleague, Miss Natalie Mason. And it's interesting. We also need to have the male listen to this broadcast, and Natalie could expand more about that. Why the males need to listen to this broadcast?
Well, we're giving the young men the HPV vaccines, as well as the young women in the practice where I am at this point, it has been proven that the boys carry the HPV and can spread it from female to female, as well as develop symptoms of certain cancers later on in their lives. So this is not only to protect the daughters with cervical cancer, but we also want to protect the boys from the same type of cancers, just a little bit different spots. So in 2012, 2016, it was approved to start giving boys age 13 to 17 the same shots that we're giving the girls, so that we can not only prevent it from being passed, but also from harbored. I work at St. Rose Pediatrics, and in our clinic, we're very pro-HPV, but we are very pro-prevention. So it's a good thing for the boys and the girls to have the vaccines, and for the parents to be aware that this is not something that just affects girls, that it affects all kids. And I work with a lot of adolescents, and this is a very hot topic, but it's also something that I do give to most of my kids. If we give the shot before the age of 16, it's only 2 shots 6 months apart. After 16 and now up to age 45, it's just been approved. It's 3 shots within a 6-month period. So the younger that we can get them, we can do it down as young as 9 for females and 11 for males. But I think that when we're doing that 11-year-old well check and they're getting some other shots anyway, it's always a good idea to try and do that first shot at age 11 so that we catch them, because statistics show that most boys and girls are exposed to HPV within the first year of being sexually active. So we want to make sure that we have them covered well before that time occurs.
There's a lot of information about the cervical cancer awareness, health awareness. And we are mentioning about the National Cervical Cancer Coalition. And there's a lot of information on the website. Natalie is mentioning about that. I think you can reiterate about the percent of the screening in Nevada and the available resources that they can go to.
Right.
Yeah.
Well, we would hope that you would, that all the readers and listeners of this broadcast will already know that you should be having your pap smears and your yearly physicals, both male and female. But Nevada screening is right now around 79% for females getting pap smears and HPV smears for the year or on their scheduled basis. What we'd really love to see is, of course, for that to increase so that we can decrease the treatments, which can be very painful and quite devastating to life cycles. The average in America is 84%. So we're not that far behind, but we are lagging a little bit. And if you don't have a private gynecologist, there's public health clinics available, as well as the Southern Nevada Health Department. I'm sure they can point you in the right direction or even provide the service. And make sure that you do check for those woman benefits and benefits for men, too. They are entitled to a well visit every year as well.
Mm-hmm. So in the process of me, I always do research before I come in and talk about the topic. So there is this brochure that I look at. It's called the HPV and cervical cancer. And there are some stories here from the survivors. And this caught my eye, this testimony right here. And she titled it, "I Wish I Would Have Known." And this is by Jen, and this is available on the website. And she wrote that on June 13, 2012, I went in for my annual exam, which is both humbling and uncomfortable. It is something that girls are introduced to early in life, and we learn to deal with it. Experts now say that if all of your PAPs have been normal, you can actually go 2 or even 3 years between tests. And I'm here to tell you that I disagree with that position. On June 20th, exactly 1 week from my annual pap smear, I got a frantic call from my doctor letting me know that my result was very abnormal. And the call itself was abnormal because up to this point, all of my annual PAPs had been normal. I had missed a PAP during 2011 because I had my period, but that was just one missed year. So my thought was that it was probably nothing. That was the general consensus of my friends, as well as because everyone has had an abnormal PAP, right? So this is Jen writing about her experience. And then she said, I met with my OBGYN on June 22nd for my colposcopy. And I asked Natalie, what happens if you have an abnormal pap smear? So Jen said that she met with her OBGYN and she had a colposcopy. And she said, I was already running worst case scenarios in my head. She said that people don't go from a lifetime normal pap test to cancer, so I shouldn't worry, so just relax. So I relaxed as much as I could with a powered microscope looking into my cervix. Then she said this, and I quote, your cervix is angry and you have a PO'd cervix. We definitely need to do something. So she continued, there were several options discussed, but the biopsy would ultimately tell the tale. So I'll stop right there. It's just to give you an idea of what goes to the mind of someone who went through diagnosed with cervical cancer and that survived. And she she titled it, I Wish I Would Have Known. Mm-hmm. So this broadcast really is to brought out to our listeners to increase awareness so then you can be aware that go and get your pap smear. Go and get your shots.
Right.
Yeah. Any other words of encouragement or wisdom to our listeners, Natalie?
Well, prevention is the key. You know, the HPV immunizations, the STD testing, if there's a possibility with that, you know, using condoms and being, you know, very specific as far as who and what partners that you're choosing. I think that it's just all has to work together. Your yearly pap smear and HPV screens, everything is for one reason, and that is to prevent these things from occurring to start with.
So if our listeners would, because you mentioned St. Rose Pediatrics, mm-hmm. and they are very strong advocate for preventing cervical cancer, is there a number that they could call to inquire? They might ask for you, Natalie.
Our telephone number is 702. Oh gosh,
blanking.
You caught me off guard here.
Yeah, well, I would know because
564-8556, I believe, and we do see adolescent females and males up to the age of 18 to 20. We do have the Gardasil shots available for them, that we do them during their well visits. We can do them during other visits also. But we want to get as many as we can protected so that they don't have to write articles like Jan did about I wish I knew.
I wish I knew, yeah.
Right.
So the number I have, I think I know because my kids go to St. Rose Pediatrics. So the number there is 702-564-8556. Thank you.
Right.
Well, any other thoughts about cervical cancer or cervical awareness?
As far as
Everything.
I'm concerned, I'm just really glad that we're able to talk about subjects like this in a health moment outside of an office environment, because it's so important to keep on passing information along as we get it. I think that's part of our job as healthcare providers, is to educate. Not only do we educate daily in our offices, but we need to get out to the community.
Yes.
And
absolutely.
this is one of the best ways to do that.
Absolutely. You know, media is very powerful now, technology. We have Facebook, we have Instagram, we have iTunes, right?
Yeah.
So this broadcast actually would be Save Us Podcast under PHLV Radio. And I wanted to thank PHLV Radio for giving us this platform to reach out to our community to keep you guys healthy. And I know that I'm going to tap into Natalie's expertise, and I know there's other topic that she would want to share with us. So I wanted to thank you for agreeing to be our radio guest here on behalf of AAPINA of Nevada. Maybe you can join our organization too.
Maybe I can.
Yes. So later on, I think, later on, if you have any questions or any topics that you would like us to cover, you can call here at PHLV Radio at, which number is good? 702-613-6433. Again, if you have any topics that you would like us to cover, we're following the monthly recommended by National Institute of Health. And this month is Cervical Health Awareness Month for January. So February, we'll talk about cardiac problems. So the number here is 702-613-6433. And wow, time flies when we're having fun. So again, thank you, Natalie.
Thank you for having me. I
Yes.
appreciate it.
And remember, our listeners out there, remember, every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.